for skilled nursing, but they also have 50 domiciliary cabins. They're the only one of us in Home Lake that do something a little different. Those cabins are more like independent living or assisted living, and the VA still covers them. To my knowledge, that's the only kind of not skilled nursing that the VA covers, but that's kind of interesting. If you ever have a chance to be up there, there are little cabins that veterans or spouses could live in. Then Rifle's our only home on the western slope that has room for 89 veterans. Walsenburg is a little different. That's connected to a big hospital. It's Walsenburg at Spanish Peaks. They're different because they're run by Walsenburg and Spanish Peaks. They're overseen by the VA. And then we have our Bruce McCandless home. That was built in 1976, and that has 105 beds. So we're the only one that's central. The rest of them are fairly rural, and they're all a little different, but they're all gorgeous. So. And as I was saying before, we can serve any veteran with an honorable or general discharge. You do not have to be service-connected disabled to be in a VA nursing home, a VCLC. We can serve any veteran. We can also serve any veteran's spouse as long as your spouse has never been divorced from you or married to someone else. So if you were married to a veteran that passed away and you got remarried, unfortunately, you're no longer eligible for a veteran home. And then Gold Star parents, which as I understand it, are parents that have lost a child in combat. And what we provide at Fitzsimmons, at my home, is long-term care. That's where people come to live with us. They're no longer safe to live on their own at home, and they need that 24-hour nursing care. We do that. We also do rehabilitation. Rehabilitation is when you go to the hospital and your doctor is saying, oh, you had a knee replacement, you need to be somewhere until you're strong enough to go home. We do that too. We also have a special unit for secure memory care at Fitzsimmons. That's for people who unfortunately have a cognitive issue where they're forgetting that they don't need to go to work. They don't need to report to their base. They're always trying to leave. They may get lost in the community. So it's it's actually my favorite unit at the home, but it's secure. It's a locked unit. And then we have hospice services. We contract with hospice that come for end-of-life care. And you guys can just yell any questions at me if they come up. Oh, is that where we're going? Yeah. Who's a Korean War veteran. I'm not supposed to say who's at my home, so yes.
But he's there. And
I love him.
Very
yeah.
happy, and it's been great for him.
Good. Yeah. We absolutely love what we do at our home. Our staff is made up of veterans and non-veterans, but again, if you ever have the chance, I will tour anybody. I'll tour you twice. Just call me. I don't care if you're not interested, if you just want to come and see what we do. But yeah, we love that. That's great to hear. So what does it mean how do you know if you are at the level where you might need our help or your spouse might need our help? So we're at the level where people aren't driving anymore. They don't have cars. They don't have pets at our building. Pets can come and visit, but we're not taking care of pets anymore. So first off, if you ever have an accident, illness, injury, surgery that ends you up in the hospital, your doctor at the hospital might say, you need some rehab, meaning we want you to go stay somewhere to have physical and occupational therapy to get you strong enough so you can live safely at home. That's doctor's orders. My next section is ADLs. That means activities of daily living. If you notice that you or your spouse is having trouble remembering to take medication on time, you really can't button your shirt, you're having a hard time getting to the restroom or getting your belt buckled, whatever that is, getting dressed, you're having trouble eating, you may be choking a little bit, maybe your food isn't a great texture for you anymore. All of those things might be a hint that you could use a little extra help. The falls, the physical injuries, medication adherence, we've already talked about that. Some of our folks have wounds. There can be pressure wounds. A lot of our folks have certain amputations that make them prone to those. Any medical condition that requires 24-hour doctors and nurses. So when you're in our home, you have a lot of independence. So if a veteran comes to us and they are diabetic and they need 24-hour monitoring, but it's their choice to eat a Butterfinger milkshake for breakfast, lunch, and dinner, they absolutely can. They're veterans, they can eat whatever they want. But you still need that 24-hour medical assistance, then you would be eligible to come and live at our home. Okay, here is the kind of complicated part. So I tried to break it down. Please ask me if you have questions. It's still a little fuzzy, or not fuzzy, but it still tangles me up sometimes. So this is how skilled care is paid for at the veterans' homes. If you are coming for rehabilitation, again, that is when you're in the hospital and your doctor says you need it. I get a lot of calls with people saying, my husband is so weak, can he come to you for rehab? Unfortunately, no. Even if you're service-connected disabled, all rehabilitation programs follow what's called Medicare guidelines. Medicare is what probably all of you have. Medicare is what you get for free when you're 65 years old. You get Medicare A. Most of you probably have Medicare A and B. So that's what covers your rehab. So if you're coming for rehab from a hospital and you're service connected at 70% or greater, that trumps everything in our home. If you're service connected disabled through the VA, your rehabilitation care and your long-term care will be free. It does not affect anything that comes to you right now. So if you're 70, 80, 90, 100% service connected disabled, and you can come to our home for long-term care or rehab. It doesn't change your pension, it doesn't change your disability, it doesn't change anything that comes to you, and everything is covered at our home. So that trumps everything. But if you're not, say you're 40% or 0%, you could still come to our home if you have Medicare. The important thing to remember is you could only come to our home for rehab if you have Medicare, if it's not managed. Managed Medicare is where you've picked a program to manage it, like United or Kaiser. Are you familiar with those managed Medicare programs, which are great for people in the community, but we're not a Kaiser home. Yes?
Where does TRICARE for Life play?
I will definitely let you know about that. So, but if you have Medicare, then, and that United, you would have to go to a United place for it. That's why they have you sign up for that. You'd have to go to a United home for, or a Kaiser home for rehab. You couldn't come to us. TRICARE for Life, very good question. In short, how Medicare works for rehab. Let's say I have a knee replacement. I need rehab. I'm not service connected. I can go to a rehabilitation home like mine. The first 20 days of my rehab is always going to be covered at 100% with your Medicare. After that, there's a copay. I believe the copay right now is $204 per day. Right. So Medicare is always going to cover up to 100 days, but past day 20, you've got a $200 a day-ish copay. People, even though, sorry? Oh, great. Most people, even if they have that 100 days, most people on average are only going to stay for rehab around 20 days. But if you're still going and they're figuring you're still making gains, you can have up to 100 days. TRICARE, if you have TRICARE, picks up that copay. So if I know somebody's coming to me for rehab, they're not service connected, but they have Medicare and TRICARE, I know they're most likely, they can stay till they get better, till they rehab, because TRICARE is making it free for up to 100 days. Did that make sense? Yep. Yeah, otherwise you have that $20 copay. And service connected, you can stay as long as you're progressing. And the VA picks it up at 100%. This bottom square here is important for rehabilitation. When it says you're under 70%, say you were 50%, and again, you injured your knee jumping out of a plane, and your rehab is for that knee. The VA will cover it. even if you're not at 70%, if it has to do with what you're service connected for. Long-term care. Long-term care is when you come and live with us, typically until the end of your life. Long-term care, if you are 70 to 100% service connected, everything is covered soup to nuts. We also accept Medicaid. Medicaid is the state-based aid system. If you think that you or someone you love is declining and they're not going to have a private pay, ability to private pay, and most of us aren't, get that Medicaid process started. Especially, almost everywhere in Colorado, it's backed up. Let me go over to self-pay really quick. If you're paying out of pocket, it's $240 per day for a veteran to live with us long-term care that's not service-connected. It's around $7,300 a month. Now that covers everything. It's all inclusive. You're never going to get a bill for oxygen or medicine or anything, but still $7,300 a month is quite a bit. So if a lot of people fall into the valley where they just don't make enough to pay that, but they feel like they won't qualify for Medicaid. But definitely at least call and check it out. If you have Medicaid questions, I have great resources for Medicaid help that will answer those questions for you. So Medicaid or self-pay, you would also have to have unmanaged Medicare. If you're service connected at 70 to 100%, that covers everything. We don't care if you have Kaiser or United because we're going to bill the VA for everything. But if you're using Medicaid or you're using Medicare and self-pay, then you would have to have unmanaged Medicare. So it's confusing. Medicaid is what you apply for. It covers your room and board. Medicare is only good for your rehab or in addition to a room and board payer service to pay for things. Medicare pays for things like labs, ambulance rides, doctor's visits, stuff like that. But it doesn't do anything for long-term care. So if you have any questions, hopefully I can make that a little clearer. They couldn't have made it more confusing by naming them the exact same thing, but.
So is there long-term care insurance that would?
Long-term care insurance for us is the same as self-pay. So if you have long-term care insurance, you would apply to us as being self-pay, and then we would give you a form that you could submit to your long-term care insurance and be reimbursed. Yeah, not a problem. Another thing I do want to mention is I am really passionate about what I do. I love our home and I love the services the VA gives for long-term care. I meet a lot of people in the general public and a lot of people on the phone that will say, my dad, my mom, they didn't apply for their service-connected disability rating. They didn't want to, they didn't want to inconvenience, they didn't want to take something from someone else, they didn't feel that they were that bad off. I wanted to let you all know you are not taking anything from anybody else. It is an earned benefit that you've earned by being in the service. If you have a hearing loss, if you have knee pain, if you have PTSD, if you have any issue at all that you think could be correlated to your time in the service, it is so worth it to call the VA. Call your social worker. Say, I want to be evaluated for a service-connected disability rating. Because if you ever need long-term care, it is the difference between $7,300 a month and $0 a month, and it is an earned benefit. So I can't stress that enough. Really, really important if you haven't done that. So at Fitzsimmons, what we do is however you're paying, we cover everything. So we have our own on-site pharmacy. We cover all your medications, all incontinence products, all room, board, food. We have a therapy dog. We do acupuncture. We do poker and blackjack and ice cream and all the, the massage. We cover all the medical supplies, everything. We also arrange for you to have things like your wheelchairs and your dental work and your eyeglasses and so on and so forth. We help your family or you figure out who's paying for that and how we organize it. So if somebody comes into our home and they're there to live with us, you would have a doctor that comes into our home that sees you. You would have things like dentistry, podiatry, optometry, ophthalmology. They all come into the home as contracted providers. That's all covered, and they do those exams there. If you have specialists at the VA, we have our own transportation that takes you back and forth. So we have that, and then you would have 24-hour nursing coverage. So we have 4 what are called neighborhoods in our building, and we have nurses on either side of those neighborhoods 24 hours a day. We have CNAs on either side of those neighborhoods 24 hours a day. Do you know what I didn't do? And I wonder if it's back here. Let me just show you. Yes, okay, so this is what our rooms look like, each and every room. So yes, you will have a roommate, sort of. We have semi-private rooms. So there's a hallway that comes into this room here. There's one room on one side and one room on the other side. These curtains pull out to shut those rooms, and you have a large shared bathroom. So a lot of people that come in say, my dad wants a private room, or my mom wants a private room. And you can put your name on a wait list for a private room once you're in our building. We have a handful. Most of the time, all the time, when the person comes up to the top of that wait list and that room becomes available, they don't want to move. They're fine where they are. They like their neighborhood, they like their staff, they like their room, they like their roommate. Because they are 2 separate rooms, we just don't have that many problems. It's part of my job to find out where someone might want to live. So if I have Michael, and I know Michael needs to have his door shut all night, or Michael needs to have his light on all night, can't stand loud noises, needs his TV on at ear-breaking levels, whatever it is, I find out all of those things from talking to that veteran. We do extensive interviews when we're going to have someone come into our home. How can we honor you? What do you need? What do you like in your living environment? So that we can make sure that the person on the other side is going to match well with that. And if that doesn't end up happening and you move in and you say, I can't stand this anymore, that guy's mattress keeps me up all night, or he coughs at 2 o'clock every morning, or what have you, then we move them and get them a new roommate. So that's how that works. Okay, let's go back. Okay, so the fun part is, I know everybody would probably say this if they wanted you to come to our home, but it really is different. We have tons of military activities at our home. We have all of the great activities, but like the usual things you would expect in a nursing home, the bingo, the poker, the blackjack, all of that stuff. But also the ROTC came and made a disco the other day, and we all hung out and did a lot of dancing. Tons of religious services, tons of military talks that we have. What else did I want to mention? The governor comes not infrequently, probably once or twice a year. All the sports teams come because people are excited to see you guys and thank our veterans. So we have a lot of groups that volunteer to come in and put on shows and do things. We had a brewer come, taught the veterans how to brew beer. I never got the beer, but they did. That was kind of fun. So all of that good stuff. And like I was saying, our veterans, if they want to shower in the morning or bathe in the afternoon, we try to make that happen as much as possible for them to do as much as they can within keeping them safe and keeping them healthy as much as they want as possible. So, okay, so if you ever know anybody, or if you yourself need our services, here's how you would go about that. If you were to have, God forbid, a fall that ended you up in the hospital, all you would need to do is tell your social worker. Everybody that goes to the hospital will get a social worker. Tell your social worker, I would like you to send a referral to Fitzsimmons. Doesn't obligate you to anything, doesn't mean you'd have to come to us. What a referral is when I get your medical records. Then I would call you or your family or your VA social worker. What I need from a veteran that's coming in is a DD-214 that shows to me you're honorably discharged and that you had active service. And I would also need your letter that says, hey, Bob, you're 100% service connected. Those are the 2 things that I need. If you're not service connected, I get the rest of your information from your family about how you're paying for the care. But you fill out an application. My job is to get all those demographics together. My partner's job is to look at your medical records and say, yep, we've got all this gentleman's medication. We can absolutely handle his needs. And that's what we do. Our challenges as far as admitting people at Fitzsimmons would definitely be, unfortunately, in addiction treatment. And we're aware we need to get better at that, especially with our veteran population that's coming up. You would think in the metro area we'd have stronger addiction support services, and unfortunately we just don't. So we're working on that. And substance abuse is another area where it's a little tricky for us, but we are definitely working on that. Right before COVID, we hardly ever had empty beds. Right now I have 180 beds, meaning I have room for 180 residents, and we have about 135 residents. So tons of empty beds. Our challenge is making sure we have enough staff to meet everybody's needs. We're not looking to just bring people in to make money. We're making sure that everybody that comes into our home has good, comprehensive care, that they're happy, and that they're safe. So, yeah.
But just to clarify, I'm a retired military. I have a fall, break a hip or something, and I need to go to a rehab place for whatever. I could actually apply with a referral to come to your facility.
Yes, sir.
And Medicare would cover 20 days.
Yes. Yep, absolutely. We do rehab. Right now our rehab, and we don't divide our neighborhoods, so our neighborhoods are all mixed up. So we have a Patriot neighborhood, a Constitution neighborhood, an Eagle neighborhood, and a Heritage neighborhood. And there's going to be people that are there full-time. There's going to be people that are there for rehab and going home. They're all different branches of the military. Everybody's mixed up. But yes, sir, you could absolutely come for rehab. What happens in rehab is that you'll go to a room, and our fantastic rehab department, because our rehab gym is in the building, and we have occupational and physical therapists there. They're going to come get you every day, and you see guys that are, I had a double knee replacement myself a couple years ago. Our guys are good. I didn't go there, but yeah, they do the great therapy with the walkers, and we have a full gym with all of the machines and the parallel bars and the bikes and everything. And then when you're done, we discharge you back home. Our social workers make sure that you have all the support you need there, and we coordinate with the VA to make sure you have home health care or whatever you need to live safely. Yeah. Does anybody else have any questions? Yeah.
So, excuse me. So, for example, my father doesn't live in the state of Colorado. Can I bring him here so he's closer so I can help out?
You sure can. I just admitted an Air Force guy from Alaska. It was amazing. So we don't have a residency requirement here. Now, if he's service connected, that's great. If he's paying out of pocket, that's great. If he's Medicaid, a person that needs Medicaid needs to live here before they can get Medicaid. So if he was counting on Colorado Medicaid, they do have a residency requirement. So you would get here, apply for that Medicaid, get it all in place, and then you can apply to us. Unfortunately, we're not what's called a Medicaid pending facility. A lot of facilities in Colorado will say, yep, we're going to take Martha over here because we know she's going to be okay with Medicaid, and we'll help her get started. That's not our facility. You have to have it established before you come. Yeah. Anybody else? And please, we have tons. You guys are nowhere near my home, but if you ever want to volunteer, give me a call. I put pens and Post-it notes and all kinds of free goodies over there you can take with you. Some brochures about us. We have a great volunteer coordinator at our home, and people volunteer all the time. Other veterans love to chat and see you guys. They do anything from bingo calling, poker playing, blackjack, ice cream serving, pretty much anything. Yeah, we have a garden club. We have a brand new greenhouse. We have, I don't know if I mentioned our therapy dog. We have more activities than you could possibly want to do in a day, so there's plenty to volunteer for. And we also have a museum of our own that I'm trying to get off the ground. So If anybody's interested, I am taking loans or donations of interesting military things from any era, and I put up a little card saying what they are. We have a World War I first aid kit out there. It had morphine syringes still in it. I had to take those out, but yeah, that was interesting. Yeah, what else do we have? Is it called, forgive me, Gatling gun? Yeah, shells in there, and uniforms and signaling mirrors and all kinds of neat stuff. But it makes a huge difference to our veterans. Most of them do have wonderful families, but some of them have no family at all, which is another thing that makes the home special. Our staff is so dedicated to making sure that everyone gets interaction. It's not a place where people are stuck in beds or just wheeled to. You will not see TVs going with 7 wheelchairs in front of them doing this. That's not our home at all. And we're all talking to everyone all day. I don't want to say it's a big family, family's family, but we love our residents and we take good care of them. So, yeah.
Could you maybe send us some pictures of your display area?
Yeah.
And we may be able to put together something.
I would love that. There was a Legion post that has a few things for me, but I have, you know who's slacking? The Marines. I don't have anything in my Marine case. I want to make it a competition, but yeah, we've got, they come about this far out of the wall, and they have sliding glass doors with some glass shelves in there. But yeah, I would be happy to. We would love that, and we can always give back things. But what we were looking for is it got a little crowded before. Our museum was all of those cases, but things have been shoved in there, and they have been in there for about 10 years. So what we were looking for is things that would be interesting to our not personal pictures, but I have a picture, say, of a Native American veteran we have right now, and it's him at the Denver powwow. So that was interesting because we could write something about that contribution. Or it was v V-mail from World War II, I believe. So I have some V-mail samples. I have a machete. I have fun stuff. If it's a weapon, it has to stay at the front desk, and then I lock it in the case. Yeah, we don't want to bring a ton of weapons in, but.
I'm sure there's something we could readily.
Oh my gosh, I'm excited because some of those guys, that's all, they come down every day. That's why I started the project, to exchange and update the museum, because that's what they're having to look at if they don't have family to take them out of the facility. So thanks. Did anybody else have any questions? Thank you so much for having me. Again, I'm sure it's not a subject everybody loves, but if you need it, you need it. Thank you.
Thank you.
Okay, so.
Mine's
All
open,
yours
mine's
out.
open as well, yeah.
Okay. Is that yours?
Nope, that's hers. So you can actually close that one out. That's me, yeah.
All right.
How is everybody doing?
Doing good.
Good.
Not to shovel much snow.
That's always a good thing. So if you don't know, my name's Tim Hutchinson. I'm the Broomfield County Veteran Service Officer. I'm over there at the Health and Human Services building. I work out of the Workforce Center. And as a VSO, I help, with veterans, with their claims, navigating the system that is the VA, which is made up of obviously the Veterans Health Administration, Veterans Benefits Administration, and cemetery. So there's always a lot of questions, and so today I want to do an update on the PACT Act, just so that everyone's aware of where we're at on the PACT Act. So the PACT Act, it is just a major expansion of VA benefits. So the act was passed a couple years ago, and they've been adding to it. So the the expansion really is on the healthcare side of things. So it did add presumptive conditions for veterans that have exposures to, Agent Orange or burn pits. There's a lot more presumptive conditions that have been added. Most of those have been added for Gulf War, since the Gulf War in the 90s, but a couple things were added for Agent Orange as well. So, and some of these have a lot. This is just to keep me on track. But a presumptive condition is something that the VA will presume is the contention is related to military service. So, for example, Agent Orange and diabetes or Parkinson's. If you served in Vietnam or one of the areas where they've now ceded the, use or storage of herbicides, then you would just need a current diagnosis of that disability. And then, the proof of the service location. So the service location would be, now it's opened up to different locations, but at the time it was mostly Vietnam, right, where they sprayed it and used it. But they did cede some of the other areas that have long been suspected of having that, right? So proof of service location, the VA will do, when you file a claim for disability, they'll do the research and look through the records. And obviously Blue Water Navy, that was a one where it took a while to get that passed, but they do look at the logbooks of where those ships were at, right? So, and anywhere inside 12 nautical miles, then you would receive those presumptions as well. And so, the VA, if you file for something, the VA will, if you have the current diagnosis and they can verify where you're at, they'll give you the compensation and pension exam, verify you have the disability, assign the percentage based on your level of severity and the rating criteria, and then they'll send you a decision. So that's essentially how the presumptions work for the PACT Act. So in Vietnam, obviously, everyone knows about Agent Orange. These are all of the conditions that were in the past that they had associated with Agent Orange. Some of them have the asterisk. The asterisk just means that it has to have been diagnosed to a compensable degree or shown to have been a compensable degree within 1 year of exposure. So for chloracne, for the peripheral neuropathy, unless the peripheral neuropathy obviously is secondary to diabetes, then you can file for that at any time. But if you don't have diabetes and you're trying to file for peripheral neuropathy, it has to have been compensable within a year, right? Well, how do you prove that? I mean, that's extremely difficult, right? So there's, and the same thing with PCT, porphyria cutanea tarda, and I don't know if there's a word that can be butchered in the English language, I can do it. So I'm not sure if that's the correct pronunciation, but I just call it PCT. So they added the hypertension and the MGUS, right? So the MGUS is a blood marrow issue that is like usually a pre-cancer type of thing that is usually monitored. So MGUS is now, the monoclonal gammopathy of undetermined significance is now a presumptive as well for Agent Orange. But understand something, just because something isn't on that list doesn't mean you can't file for it if you do a little research and see that something could be related to Agent Orange, right? So just because it's not on that list doesn't mean you can't file for a direct service connection. Might take a little more effort on your part to get it service connected, but it can still be filed for. And so the criteria obviously is what the older criteria, where's my, do I have a laser on this one?
Well, it won't show up on the screen.
Oh.
Yeah, the TV.
All right, so it doesn't matter, I'll just point. But so that is the criteria at the time before the PACT Act, right? So they wanted, the perimeter duty in Thailand, right? So they said you had to be working near the perimeter and before we're going to cede, that you were exposed to Agent Orange. Which, they added new locations for this, right? So any Thai, U.S. or Royal Thai Air Base in Thailand, regardless of you work the perimeter. If you were stationed there, you get the presumption. Laos, Cambodia, right? So from those time frames, so they have very specific time frames for some of these. Guam or American Samoa, all the way up to 1980. If you were stationed at Guam or visited in Guam, as for Liberty Port, if you were in the Navy for a certain period of time, and you can show that in your record somehow, then you can get those presumptions. And Johnson Atoll as well, 72 to 77. So that's some of the places. There's other places that people say, well, I know they had it here and there, but these are the ones that they're fessing up to right now. So any of those locations now open up presumptions for Agent Orange. And then for healthcare access, any of these places during those time frames. So this is what I'm talking about the expansion of healthcare. The TERA, which is the toxic exposure risk activity. So the first two, I believe, were cleanups from hazardous materials and exposure to those. And then the last one, I believe, is was an issue with on a plane that had a nuclear weapon that they had to, that people were part of during that incident and the cleanup thereafter. And so those things are now also presumptive for ionizing radiation exposure, which means that will get you in the VA healthcare system. And that's really the key with the PACT Act. And then in the Gulf War, there's a lot of different, and a lot of them are going to be things that are not really associated with the same conditions that the Agent Orange is. Obviously, this is a whole different set of issues, and a lot of them are related to burn pits or other local diseases that can be incurred in those places. And then these are all the places that, for the younger veterans that served after 1990, places that are now open to, if you've been in any of those places during that time frame or after those dates, that you can apply for VA health care. So it's that exposure risk, right, of toxic exposures that has really opened up the VA healthcare system. Because it used to be the only ways in the VA healthcare system were you have a service-connected disability. If not, were you in Vietnam or certain areas that they would look at, and then or in the Southwest Asia, and then or do you meet the criteria of income guidelines? Yes.
Yeah, Tim, maybe it was on one of the other listings, but exposure to toxic fumes from burn pits.
Yeah.
I mean, that's now.
So that's what this is here too. So, and then this is more Gulf War stuff because of those exposures to the burn pit, and that's really why these locations are really opened up, is because of the burn pits, right? But so these are all presumptives for post Gulf War, and so they've opened up a lot of them. So these have been added fairly recently, right, by the PACT Act. All these, and as you can tell, these are all inhalation. Oh, yeah. So and you can see these are all lung related. So this is going to be all toxic exposure, right? So chronic bronchitis, asthma after service, COPD, rhinitis, sinusitis, interstitial lung disease, bronchiolitis, pulmonary fibrosis. So there's a lot of these are going to be caused by burn pits. So here's the 2024 changes that are really interesting, that are really opening them up. So TERA is the toxic exposure risk activity. Can't talk today. And so the Terra, they can do what they call an ILER, the individual longitudinal exposure record. And they basically track where you were in service and say, okay, you're in one of these areas that we can give you the entrance into the VA. You qualify, you have eligibility into the VA healthcare system based on where you were located. So VA has determined veterans who are exposed to one or more of the following hazards. So this is where they open up as well, right? So, or for active duty or training, or even inactive duty training, that you participated in that, that risk activity, right? That toxic exposure risk activity, and it doesn't matter, regardless of your location. So, air pollutants, right? So, depending on where you were located, chemicals, right? So there's a lot of chemicals that in certain types of jobs that you were exposed to. I know just in my job when I was in the Navy, we had all kinds of solvents we used, and I wouldn't even know what some of them were. So, they just all came in a green can. That's all I know. And then occupational hazards, so asbestos, right, the industrial solvents, leads, paints, including, chemical agent resistant coating, firefighting foams. So something that we've done is we used to do, the non-skid on the decks, right, and chipping that up. So radiation, obviously, there's different forms of radiation, warfare agents. There's certain places and certain bases, and actually on the VA website, you can drill down to specific bases that have exposures. So there's bases, and obviously we have the groundwater contamination at not only Camp Lejeune, there's other bases that have the AFFF that got in the drinking water. So it's really expanded who can be enrolled in VA healthcare. So it's not a comprehensive list, and right there, the publichealth.va.gov exposures, that has a really good listing to drill down and be able to get all that information on what type of exposures, where they were. But this is a way into the VA healthcare system for people that have been denied in the past. You can reapply, and they will relook at a lot of this, and you can even put in the comments when you're applying for it some of the things you were exposed to. And if you're enrolled in VA healthcare already, right, or if you're not, how do you enroll? Well, it's a simple application, 1010 EZ. I have some here. I can leave them here, Mike, if anybody would need an application. Has an instruction page where to send it. But if you're not in VA healthcare, I think we just found out how important it is to be in it, right? And so it is important, I think, to apply for it, right? So all they can say is no, and tell you why they say no. And then we can figure out, okay, well, how do we get to yes, right? How do we show them, prove to them that, maybe there's something there that you were exposed to, right? But all they could say is no. They'll make sure that your birthday doesn't get taken away. So this is the local. If you're enrolled in VA healthcare and you haven't done the toxic exposure screening, they're wanting everybody to do that because they're trying to track the clusters, veterans that served in certain areas and track their health to see if there is something else that comes up on the radar and says, hey, wait a minute, we have a cluster that served in this area and they're all having this condition. Let's do some more studies on that and see if, and that's basically how they make those presumptive conditions, right? Is they say, okay, there might be something to this, let's do a little more research. And then they find out that, okay, they were all exposed to this causes this, we're gonna make that presumptive and for people that served in that area. And so that's what they're trying to do now and stay ahead of that. So they want to do these toxic exposure screenings every 5 years or so, just to track your health, and it's just a questionnaire. They'll just essentially call you on the phone, and you pull out a sheet and you can read to them, all the things that you were exposed to. So that is done through the Colorado Eastern Colorado Healthcare System, and you have to be enrolled in VA healthcare in order to go through that toxic exposure screening. And again, it's just a phone call, so you could start writing stuff down that you were exposed to, and then, when you call them and leave a message, and trust me, by the time they call you back, you'll have everything on that sheet, because they're not going to call you back for a while. I'm still waiting for my call back. But I did leave the message, and they will call me back eventually, but they have to get through everybody, so it's going to be a process. VA benefits phone number, if anyone needs, to ever talk to the VA benefits, VBA about anything, you have questions, change direct deposit. You need a benefit eligibility letter, right? So, a lot of times you need that benefit eligibility letter if you're filing for a tax, possibly a disabled veteran license plates if you qualify, or anything that you might be applying for. You could need that veterans benefit, the eligibility, the summary, benefit summary letter. They can send that to you real quick, because usually they want a current one, so when they send it to you, it'll have the day's date that you're talking to them on the phone. So, but they can do that real quick at that. And then here's the VA healthcare phone number for the VA national line for healthcare. So if you ever have questions on healthcare for VA and you want to talk to somebody in the know, the national line is pretty good. If you call locally, a lot of times you're going to have to leave a message. You'll get to talk to someone usually. I'm gonna say usually. Get to talk to somebody if you call that number. So it's important to, just to know that where to reach out to the VA, because a lot of people still confuse healthcare and benefits, right? So, I've been to the VA healthcare and I got this, and this, and my benefits didn't go up. Well, they're not gonna, because those two don't talk to each other. You still have to file for the benefits for increases or what have you. But I think that the expansion, if someone doesn't have VA healthcare, I mean, there's people like, that say, hey, I have TRICARE for life, why do I need it? Or I have Medicare, why, I don't really need VA healthcare. But I'd say circumstances can change fast. And so rather than trying to jump through hoops later to get into VA healthcare, you could try to get in it now, and then you only have to go once a year for a physical to stay active. You don't even really have to use it if you don't want to, but it doesn't interfere with your other insurance. Yes, sir.
I was going to ask, I have TRICARE for life, and I'm just curious, what is the difference between that and VA healthcare?
They're totally different, because the VA healthcare isn't an insurance, it's a healthcare system, all on its own. So it's not an insurance of any sort. So if you say you had a health setback, like she just talked about, that it has to do with rehabilitation, that you might need some rehabilitation. How much is TRICARE going to pay for, right? Compared to what will the VA authorize, right? The VA can also authorize hospice care, end of life care. They can contract for different facilities if something is related. So do you have any VA disabilities at all?
Nothing, well, hearing maybe.
Okay, so that's something too that the VA would then be obligated to take care of. If you had a service connection for that, they'd be obligated to take care of hearing aids if you got a service connection. But they also have discretionary spending, and they have a certain amount of discretionary spending. So even if you're just enrolled in VA healthcare, you may get, even without a service connection, they may give you hearing aids, without cost to you. So, I mean, it depends, but I would say it's worth, you know, applying and going once a year for a physical, because it may get to a point where, like I said, there's a health setback or some type of change that you have in your health, and the VA may be so if you have your VA PAC team, patient line care team, you have a social worker, right? You have your doctor. That social worker might say, hey, you know, you could qualify, we have this, because you're just enrolled in VA healthcare now, no service-connected disabilities, but now you're getting older, you had a health setback, you need some help in the house from time to time. The social worker can say, okay, we're going to authorize nurse visit, you know, once a week for a few hours or something like that. Or there's a program called Veteran Directed Community Home-Based Service Program, which they can authorize that you get reimbursed up to a certain amount, and you have to be enrolled in VA healthcare to apply for this program. And if you are accepted into this program and you need some in-home care, and they say, okay, we're going to reimburse you up to X amount every month, then you can get your own care, pay for it, get the reimbursement from the VA, and if you don't like the care you're getting, you get rid of them and get some care until you find someone who you like, and it's not necessarily a VA contract where you're stuck with who you get. It's veteran directed care, so you could direct the care as you need it and get reimbursed up to a certain amount. But you need to be enrolled in VA healthcare to apply for that program. So it has its benefits, right? That might not be something I think that TRICARE has. So
Right.
it might be worth applying for it and you know, going, like I said, once a year, rather than, because I do get calls a lot that they never applied for VA healthcare, they have a health setback, I got a relative on the phone and they're scrambling to try to get some help from the VA. Well, now we got to enroll you first and jump through all those hoops that weren't jumped through previous. So that's why I tell people being a little proactive on this can be a benefit.
And
Yep.
that's that 1010 form?
1010 easy, yep.
Okay.
I have copies of those here, and I'll leave them here, and I got some pens. We're also, so the City and County Broomfield also has a Veterans Appreciation Month coming up in May. And there's a lot of different events that are going to be taking place throughout the month of May, including a luncheon over at the Senior Center. I don't know if anybody made it over there last year for the Veterans Appreciation Luncheon, but it's a pretty good time. I can testify to that. And so there's information there on all the events that are going to be happening in May. You know, I'm going to leave that. So, and I think we're actually coming back in May, a couple more weekends. So what is it, the 11th or something? I think. We're going to be here after the coffee and conversation outside. There's going to be some booths set up, well, a table set up with some different information from different local services and things, and that's coming up in, I'll have to look at the calendar.
You did that last year.
Right.
That was
Yep.
very popular.
Yeah, so we're doing that again here coming up in May here. And so that, I believe, is on there as well. So does anybody have any other questions? Yes.
You started to speak about income.
Yes.
You didn't finish the statement.
Income? So it used to be that income was one of the guiding factors. If you don't have a service-connected disability and you weren't in one of the areas where you were exposed to Agent Orange or in Southwest Asia Theater of Operations, then they would look at income as a determination for health care. And so household income, and I believe in this area it was around $50,000 of household income. If you made more than that, they would say, okay, you're not accepted into VA health care. So by them adding all these new toxic risk exposures. So if you've been exposed to any of those things, asbestos, if you served on a Navy ship, you were exposed to asbestos. Everybody knows that. So they're opening it up to be able to apply for VA healthcare without meeting one of those other criteria, because now the criteria is, hey, if you were exposed to chemicals, paints, you know, that, so the income is not such a factor anymore for being able to apply or be denied for VA healthcare, although they will still look at it if none of this applies to you. But they've still opened it up quite a bit, right? Yep,
Well, I served in Vietnam in the rivers. You and I have chatted.
yep,
But I was in the CIA for 14 years, and all those Middle Eastern countries you named.
Right.
Every one of them,
right. So, but the CIA is different
I know.
because there's no DD-214 associated with that, right? So it's active duty military. But contractors and different things, you know, I don't know what type of
No, I work for the agency.
yeah, so I don't know what type of recourse you would have for any health conditions through them. Not aware of that because, yep, so, but I think that, because I've also talked to other people that were, that have been in those areas, but not while they're in the military. It was after military service, and they contracted in there, and they do have a DOD, for contractors, a DOD type of program that you can get compensation through. Yeah,
I got what I need to know.
yeah, there you go. So, any other questions?
So it sounds like we should apply whether or not, yeah.
Well, I mean, it's up to you, but I would always say circumstances change, and why not have it in case? You know, because a lot of people are like, well, I'm good, I have TRICARE for life. I get calls all the time, people that have TRICARE for life, that circumstances have changed and they're trying to get some assistance from the VA now. So, I mean, I always say it's better to have it and not need it, right? And not have to jump through those additional hoops once you do have a health setback of some type. So I would recommend, you know, applying and enrolling in VA healthcare for everybody. Just because they've expanded it to the point where making it a lot easier to be able to apply and to be accepted in VA healthcare. So, well, all right. Well, thank you very much.
Thank you, Tim.
Thank you. And Tamara, thank you so much
Yes.
for planning on. Here's one of our challenge
Thank
drawings.
you.
And there's the card for our curator. And if I could get